Hello, I am Dr. Priyanka Mehta, obstetrician, gynecologist, laparoscopic and fertility specialist from Diva Women's Clinic, Chennai. Today I am going to talk to you in the second part of the series about when to meet a gynecologist. Now I am going to tell you what happens in the Gynaec visit. Now in the Gynaec visit, what we do is we take a detailed history in which we will ask you about the last menstrual period, how your periods have been, how long they last, are you having any heavy bleeding, what is the frequency of your cycles. We will also like to know about any other medical problems that you have had or you're taking any medication for, like any problem with the thyroid or blood sugars. And then we will also ask you about any surgeries that you've had in the past. Also, we would like you to share any information in your family, which is an important information in terms of any cancer in the family or any other diabetes or hypertension or thyroid problem in the family, any other medical condition which could affect your problem also at this point of time. The other thing that happens next is we will check your height, we'll check your weight, we calculate your BMI, we check your blood pressure, and then we do a thorough examination of the thyroid and the breast, and then you will be asked to lie down, and then we do a examination of the abdomen or your tummy to make sure that there is no tumor or any other reason for which you have any problem. After this, there is a tiny instrument which is called a speculum. We insert that to take a look at your vagina, take a look at the cervix, to take a look at the organs to make sure that everything is okay. Which is followed sometimes by a pap smear, which is a screening test for the cancer of the lower part of the uterus or the cervix, and it can help detect any infection or any pre-cancer stages much before the problem has started. Then a pelvic examination is done, which again is not painful. Sometimes it is uncomfortable. So you have to feel very comfortable and relaxed when you go to your gynaec for a checkup, especially when there is a problem with your periods or there is a problem in which you are gaining weight or your periods are getting irregular and many other conditions which will only be detected once you go to a gynecologist, and then we will most probably write a few blood tests to you to find out what the problem is, and also offer you a transvaginal scan or an ultrasound in which we get to know very clearly what is happening in the uterus, what is happening to the lining of the uterus, which is called the endometrium, what is happening to the ovaries, because the ovaries sometimes don't give us any symptom and their problems are very silent. So doing an ultrasound or a transvaginal ultrasound once a year or once in 6 months, depending on your clinical condition, is a good idea to diagnose certain conditions in the uterus or in the ovaries before they become problematic. So do not worry, do not hesitate. At different age groups, we have different kind of examinations which are done. In a teenage or an adolescent age group before marriage, we don't do a pelvic examination, but we can detect other problems like a polycystic ovarian disease or anemia or thyroid problems. And next, in the 20s and 30s, if you come to us for a preconceptional checkup, like if you have planned your wedding in a very elaborate way, it also makes sense that you plan your baby the same way. So before you plan a baby or before you plan your pregnancy, do make sure that you meet a gynecologist. You will be advised folic acid tablets, there may be certain vaccines which you may need, and certain blood test and ultrasound that you will need before you plan a pregnancy. In the same way, in the age group of 40s and 50s, you again need to go to a gynecologist where a pap smear will be done, and you will be again a thorough checkup is done of the uterus and the pelvic organs, and with the ultrasound we can make out if there is any problem and if there is any issues which needs a surgical intervention or a medical intervention, you can be advised that. So make sure at each stage of life, whether you're a teenager, 20s, 30s, 40s, 50s and so on, make sure you keep a lifelong bond and be comfortable with your gynecologist and visit them regularly. Thank you.